I'd like to call the House Health Committee to order. Will the clerk please call the roll?
Representatives Alexander, Boyd, Byrd, Clemens, Freeman, Gant, HAKEEM, Hall, Helton, Hicks, Jernigan, Kumar, Marsh, Mitchell, Ramsey, Sherrill, Smith, Vaughn, Whitson, Williams, Vice Chair Leatherwood, Chairman Terry.
Here.
Mr. Chairman, you have a quorum.
All right, thank you. Do we have any personal orders? Okay, seeing none, we've got a pretty robust calendar. The plan, we have this room until criminal full committee needs it. So that means we may have it until 3:30 or later. In the event that they come in at 3:30 and we have not finished our calendar, then we will recess and come back after they have concluded to finish our calendar this evening. So with that, we have, like I said, a robust calendar. I'm going to pull up, since we have the Attorney General here, pull up House Bill 1132. Chairman Farmer, you recognize?
Thank you, Mr. Chairman, members. And this is House Bill 1132, and I believe we had adopted, Amendment 7289. Is that correct?
That is correct.
Okay. And then I believe we left off, there was testimony. I believe members were asking questions and we ran out of time. So I'll be happy to answer questions on the general, and his staff are here. Happy to answer questions from members.
Okay. Do any of the members have any questions for the sponsor or any need to go back out of session? Okay. Seeing none, we're going to vote on House Bill 1132 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, members, Mr. Chairman.
All right, thank you. That brings us to item number 4. And I do not see Leader Dixie, so without objection, we will roll item number 4 to the hill. That brings us to item number 5, House Bill 1509. Representative McKenzie, you're recognized. You have a motion, a second. Okay, you do have a motion on a motion, a second on Amendment 4004. Okay, you're recognized.
Thank you, Mr. Chair. This bill does two things. It utilizes alternative methodologies for reimbursement rates for child care providers, and it also encourages shared services to improve the quality of these facilities. It authorizes the DHS to develop new strategies, encourage shared services that'll help our child care facilities keep their doors open. Every year, University of Tennessee, the Boyd Center for Economic and Business Research is recruited to conduct those. And so what this bill would do is allow them to use alternate methodologies that take in consideration things like the weekends, if they're keeping kids on the weekends or keeping kids overnight, trying to help them create a better environment for our child care facilities. And again, as I said, they can share some costs, maybe have a centralized kitchen, counting services, things of that nature for centers of a certain size, less than 50. And so that just, in a nutshell, this bill helps them keep their doors open, keep things moving. And it's been supported by friends at the Tennessee Quality Child Early Education, and the department is deferred on the matter.
All right, thank you. Any questions on the amendment? Okay, seeing none, we are going to vote on Amendment 4004. All those in favor say aye. Opposed? Okay, ayes have it. We are back on the bill as amended. Any questions for the sponsor of the bill? Okay, seeing none, we are going to vote on House Bill 1509. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chair and Committee.
Thank you. That brings us to item number 6, House Bill 996. Representative Love, you are recognized. You have a motion and a second. And there's an amendment, I believe, Amendment Drafting Code 5799.
Yes, sir.
Okay, I need a motion. Do you have a motion and a second on the amendment? You are recognized.
Thank you, Mr. Chairman. When we talk about child care providers, the Department of Human Services has programs already utilized to look at alternative ways to reimburse them for child care. This piece of legislation simply says that they will publish on the website an overview of child care services and the methodology used to issue payments to providers of child care services. With that, Mr. Chairman, open for any questions.
Okay, any questions on the amendment? Okay, seeing none, we're going to vote on Amendment 5799.
Yes.
All those in favor say aye. Opposed? Okay, ayes have it. We are back on the bill as amended. Any questions for the sponsor? Seeing none, we are voting on House Bill 996 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Calendar and Rules.
Thank you, Mr. Chairman and committee members.
Thank you. That brings us to item number 7, House Bill 1088. Representative HAKEEM, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman. We do have an amendment on the bill, 4797.
There is not an amendment.
Okay, all this does is dealing with the expiration date. You don't have that.
I think that may be a Senate amendment. We do not have an amendment
I
that did not
apologize.
come up, so
I apologize.
we're not.
Oh.
You can conform with the Senate.
Yes, sir. All right, sir. Okay,
Okay.
thank you. Thank you. What we have, Mr. Chairman and members, is that homeless persons have dispersed from shelters and other places of that nature because of COVID. And as a result, their disbursement can create problems when it comes to using new needles. And that spreads the process in regards to HIV and hepatitis. And what this bill would do is to afford approved syringe exchange services providers an opportunity to assist these persons. And they do have mobile facilities, Mr. Chairman. And I will say that the City of Chattanooga administration, also the Chief of Police, have not expressed any concerns or problems in regards to this. In fact, the police department said that instead of having to pick up a lot of needles, which creates a problem for officers, this exchange process is very good. I know of this is just dealing with the 4 major cities, and no concerns have been expressed in regards to from the 4 major cities. And as you said, Mr. Chairman, this has passed in the Senate. And with that, I ask that we move forward on this, sir.
Right, thank you. We do have a question here. Representative Smith, you're recognized.
Thank you, Chairman. And my colleague who lives in Chattanooga and I share much of this same area. I just, maybe I'm the Lone Ranger here, but I've been stuck by needles. I've had to get shots in the hospital because I've been stuck by needles. I have a concern about exchanging needles and creating an incentive in public spaces for homeless to come and exchange needles rather than having a fixed location where you've got your sharps containers, where there are, there's not the possibility of having children or the public exposed. If you could walk me through what the implementation of this bill is going to look like. Thank you, Mr. Chairman.
Representative King, you're recognized.
Thank you, Mr. Chairman. My understanding of this process it says in parks, but we know entities like in Chattanooga Coolidge Park or Miller Park, this would probably not be feasible. But what we're saying is that the entities, the exchange services will go to where the people are. And at this time, where they are is in encampments. My understanding from the police and administration, there are no encampments around Miller Park or Coolidge Park. And with the exchange services, this limits who handles those needles. And as I said, with the police department, they don't have to go around, trying to pick them up and things of this nature. I didn't know if that answers your question.
Representative Smith, you're recognized.
Thank you, Mr. Chairman. And, my colleague again made the point that I was hoping to hear, that, there are homeless folks that are very unfortunate in their state of homelessness, and they're living in encampments. This bill lifts the prohibition of a needle exchange program to be within 1,000 feet of a school, within 1,000 feet of a park. And so, and again, I don't want to relegate the homeless anywhere, but I certainly don't want to create an incentive for them to suddenly be within 1,000 feet of our schools, within 1,000 feet of our parks. And so, unless I hear something remarkable, I'm unfortunately going to have to vote against your bill. Thank you, sir.
Representative King.
Thank you, Mr. Chairman. As I said, there's been no concerns expressed to me from the other major cities, nor from the city of Chattanooga. It has passed in the Senate, and I would hope that we give consideration to passing it here in the House. Thank you, sir.
All right.
Mr. Speaker.
All right, thank you. Vice Chair Leatherwood, you're recognized.
Thank you, Mr. Chairman. And I actually shared the same concern and had the same questions where I believe we ought to be working to move this away from the parks. If there are encampments there, to reposition those. And I do have concerns with encouraging the activity in the parks where our children should be free to play without the hazards of needles or people, using the drugs that we apparently are giving them the needles to use. We should be doing all we can to, yes, help these people, but to move all this activity from our public parks. So that concerns me as well. And, I would think the 1,000-foot range at this point would be good and should not be removed. Thank you.
All right, Representative King.
Okay, and I think that's what we're saying, Representative Leatherwood, is that the 1,000-foot limit is still in place. And in addition to that, there's a mobile aspect to this for this to happen, not in, we'll say, in the open, in the parks. To my knowledge, there has nothing been said that will encourage this to take place in the parks. With the mobile aspect, it can go where the people are in their encampments.
All right, Representative Leatherwood.
My understanding, it says changing the 1,000 feet to any distance of a park. And so it would be allowed within a park. And I don't know if that's a question for legal or the chairman or someone else, but do you have a different understanding with it then?
Representative King.
Thank you, Mr. Chairman. I would ask legal to give us this clarification.
All right, without objection, we will go out of session. Give us your name and who you're with, and give us your interpretation.
All right, Zach Brown, Legal Services.
Yes.
So, Representative HAKEEM, let me just, I guess, looking at your bill number 1088, this bill amends section 68.1.136 by deleting subsection G, which deals with the distance limits of for parks and schools. And looking there at section 1.2 of the bill, it states that a program established pursuant to this section shall not conduct an exchange within 1,000 feet of a school that is located in these specific counties. Looking at the code 68.1.136, which is the section that is being amended, G2 there reads, a program established pursuant to the section shall not conduct an exchange within 1,000 feet of any school or public park. So again, your bill removes the provision that a park is limited in its relation to a exchange.
So for clarification, these exchange programs could set up whether mobile or a structure within a park.
Based on the language of the bill, that seems like it may be doable.
All right. Any questions for legal while we are out of session? You're recognized.
Okay, thank you, Mr. Chairman. I don't have everything before me here, but I thought originally the literature said originally for schools and parks was 2,000, and it was changed to 1,000. But from what I'm understanding from you, is that there's no limitation when it comes to parks.
Well, sir, Representative HAKEEM, there is a limitation for parks and schools outside of certain counties, the sort of big four counties, so to speak. However, your bill changes that limit for those specific counties and removes parks from that limit.
So there's still, for clarification, within those counties, there is still a limitation for 1,000 yards
For a school.
for a school,
That's true.
but there is not a limitation for a park
But
with this bill.
by the language of 1088, yes, sir.
Further questions while we are out of session?
Okay.
You're recognized.
All right, Mr. Chairman. I guess just going by what I'm reading here, as you said, with the 2,000-foot limit originally, and what I'm reading here says 1,000 feet of a school or public park. So I don't know if I'm misreading it, but I think what I'm reading is you still have the 1,000-foot limit. This is in the legal summary of 1088. Oh, okay.
Second paragraph. This bill authorizes within any distance.
Okay, all right, thank you. Okay. Yes, sir. I apologize, I didn't read it fully.
Okay, all right.
Okay.
Any further questions while we are out of session? Okay, seeing none, we are back in session. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. And Mr. Sponsor, to put it in perspective, certainly the limitation of distance was placed there in the current law for a reason. I wonder what the reason was, but then I would also like to understand, has that reason changed? Have things changed that we want to eliminate this distance restriction?
Representative HAKEEM, you're recognized.
Okay.
I'm sorry, he was distracted. Okay, let me,
Okay,
I can repeat it if you want me to.
if you would, please.
Sure. What I was saying is that there was a distance limitation placed for these needle exchange programs from parks and schools.
Yes, sir.
Do you know what the reason for that was? I think we have an idea.
The-
And then has that reason changed so that we feel comfortable in eliminating that distance restriction?
Representative HAKEEM.
Thank you, Mr. Chairman. I would have to say that because of the concept of the mobile piece, that it would not be, I'll use the term, just any place within the park, but it'd be centralized location that really it would be on the edge, I would believe would be on the edge of the park. Yes, sir. I don't know if that answered your question.
Well,
Representative
thank
Kumar?
you.
You're
Thank
right,
you.
guys.
Thank you, Mr. Chairman. I think there is a little bit of a discomfort about understanding it completely, but thank you. Thank you, sir.
Okay, thank you. Chairman Vaughn, you recognize?
Yes, sir, Mr. Chairman. When I'm reading this, I think I understand what is trying to be done with the program to be able to move it from one place to another to get into a higher density of users to where we can basically do this needle exchange program for the good of those addicts. And I understand that's a worthy goal. And what gives me heartburn is the fact that we are allowing these to go, basically the distance buffer between the parks has been cast out in this effort to make it to where these programs are relocated to. I'm as it's written, unfortunately, we can't vote on the nobility of the cause, but on the words on the paper. And so when we're looking at it, I don't necessarily think the cause is all bad, but I think opening up our parks to needle exchange programs as a result of that, I think we may have gone beyond where the program went from being good to where we may have some unintended bad consequences. I would certainly, to my good friend, my neighbor on the coolest hall in Cordell Hull, I would suggest, and I know we're up against a little bit with this being the last meeting, but if you roll this to the first calendar of next year and get some safeguards where you can address mine and my colleagues' concerns about it while still allowing this program to get the mobility that it needs to go to meet the need that's there, I would sure feel a whole lot better about it, me personally. But that's my perspective.
Representative HAKEEM, you recognize?
Could I defer to?
Yes, Representative Mitchell, you recognize?
Yeah, thank you, Mr. Chair. And I know a lot of people, they move it to the next calendar next year. Mr. Chairman, you give us guidance here. I think if he just took it off notice, then he wouldn't, if he's not prepared on the first calendar next year, he hadn't had a chance to talk with some people, that he can just put it on calendar again and he won't have wasted a calendar notification.
Hold on just one second.
Okay. Okay.
Okay. Without objection, I'm going to call for a brief recess.
Bo.
Okay, so for clarification, this bill has been calendared 3 times, and so we have 2 options. It either passes out of this committee, or it goes to the special calendar. It cannot be rolled to next year, cannot be put on first calendar next year. So we either pass it or it goes to the special calendar, which would be heard at the end of today, at which point we either pass it or it goes to the clerk's desk. If it goes off notice, it goes still to the special calendar.
Okay. If you would, let me defer one more time to Representative.
Representative Mitchell, you're.
Mr. Chairman, would it be in line if we go to this afternoon, we get an amendment drawn up to correct this situation the sponsors run into? Don't make me call Ramsey.
Just, we could potentially roll that to the heel of the committee. Chairman Williams, you recognize.
My good friend over here in the light-colored linen suit and I were having a discussion. And I do believe if we kill this bill and just vote it down, then that is also an option, and then he could take it back up in the back half of the session. Is that not correct? Because it fails.
If for clarification, if the bill fails, he can refile another bill next year on the same issue. Let me get one more piece of clarification. Okay, so it either fails. If it fails, it goes to the special calendar, or we pass it. And we have to, yes, on the third.
Anything other than.
You're recognized.
Anything other than the bill passing, we have to send it to the special calendar. If it doesn't leave the committee for whatever reason, then even if it does, yes, sir.
That's the clarification that we've gotten. Chairman, you recognize.
Just to be clear, if it goes to the desk, he can pull it off the desk every time, correct? Next year.
Yeah, it would go back to the clerk's desk. Representative King.
Thank you, Mr. Chairman. I want to firstly express great appreciation and thanks to all of you for your willingness to try to work with me on this. But it may be, I'm making it more complicated than it should be. And what I'd like to do is, what was that? Put it on the clerk's desk? Hold it on the desk.
So our options are either we pass it or it goes to the special calendar.
So what we will do is we'll put this on the special calendar. And then when we bring up the special calendar, it goes to the clerk's desk. Okay. All right. All right. So without objection, House Bill 1088 will go to the special calendar.
Thank you, Mr. Chairman.
Okay. All righty. Without objection, we're going to go out of order to item number 13, House Bill 829. by Chairman Kumar. You are recognized. Yeah, you have a motion, a second. What's going on? Yeah. Yeah. Okay. Yeah, you're recognized, but she's not.
Thank you, Mr. Chairman and committee.
I need a motion. Yeah, motion, a second.
You heard me sing praises of medical science, especially in the United States. There are tremendous advances, and we have a lot of treatments for a lot of conditions and diseases, and medical science always comes through almost. However, we don't have cures. The emphasis has been generally on coming up with treatments and not with cures because treatments are more profitable at this time. The Bill 829 incentivizes innovation towards a cure rather than the treatment of a condition. I have the honor of having with me today Speaker pro tempore of the Ohio State Representative, Mr. Jim Butler, and he's going to testify. The idea is it is his initiative to create an interstate compact where various states join and create a compact together and define what are the conditions where a cure is needed. Then if a person or a corporation comes up with a cure, they will be entitled to, after approval by this compact of various states, that person or corporation will be entitled to all the money that the state would have saved in taxes for a period of 5 years. In return, the compact will own the intellectual property rights and all rights to the cure. Again, it will not be a treatment, it will be a cure. The compact consists of commission that will be established, and each state gets to nominate one representative to the commission. The state of Ohio passed this in 2019. 12 other states are considering it at this time. And it will become operational when at least 6 states have joined the compact. This will help make cures to be widely available again, rather than just treatments of disease. And with that introduction, Mr. Chairman, if it's okay with you, I would like Speaker Jim Butler from Ohio, who has traveled here today. The news that he brought are also in Dayton, Ohio, that there was 3 inches of snow this morning. But it's very kind of him to come and travel, and I would like to request that we go out of session and hear from him.
All right, without objection, we will go out of session. And you can come on up to the desk there. Make sure the microphone's on. There should be a little red light that comes on, and just give us your name and who you're with, and try to keep your comments to about 3 minutes.
Thank you very much, Dr. Kumar, Chair Terry, and Vice Chair Leatherwood, members of the committee. My name is Jim Butler. I'm the former state representative from Ohio, so we have term limits in Ohio, and so I term limited out at the end of December. But it's an honor to be here. I appreciate you going out of order, Mr. Chair, so I can testify. And as Dr. Kumar mentioned, this bill creates a multi-state compact that offers future taxpayer savings as an incentive to any entity that develops a cure for disease that would result in actual savings to the states and to their state budgets. And Mr. Chairman, I'm going to go off of my written comments here, and I understand that the need for speed here, and just start with what's the problem? Why do we need this bill? And the answer to that is, as Dr. Kumar mentioned, our current system incentivizes treatments over cures. And that's because the government, for all the money that they spend through NIH and all the charities, all of that money goes for basic science research. None of that ever develops into a new product. They don't do human clinical trials, just the private sector does that. And because only the private sector does human clinical trials for new products, then they're guided as, of course, they're companies. They're looking for whatever's going to economically incentivize them the most, because it costs a lot of money to develop a new drug. So they choose treatments because it's more lucrative to develop treatments instead of cures. So this happened, and I'll tell you just real quick, personally, why I'm so passionate about this. Both of my parents passed away of cancer in their 50s. My mother, breast cancer at 51, and my father, breast cancer at 58, or pancreatic cancer at 58. And I went to go look for clinical trials, as so many other people do with so many other diseases, Alzheimer's, multiple sclerosis, so many different diseases. And I didn't see anything once their cancer spread that might save their life, just something that might prolong their life, a couple weeks or a month. And I didn't know why at the time, and now I have after many years of looking at this, and it's because of what I just mentioned. And so that's the problem. This bill is the solution. This bill offers that savings, and I can go over to the mechanics if anyone asks, but again, it's in my written comments. There's no risk to the taxpayer because only the actual savings, and only if actual savings happen, that's the only thing that's shared from the compacting states. There's no appropriation to this other than normal multi-state compact dues. So there's no risk in doing this, and it's completely permissive for companies. If they want to claim the reward, they can, which would be tens of billions of dollars for most major diseases, well over what potentially somebody might make for a treatment. But the benefit of this, it could be massive. Maybe it won't work, but if it doesn't work, it didn't cost anything. But if it works, it could save millions of lives. And what a great thing that we could do together if we can do that. Unintended consequences would be few. Again, because the way the mechanics of the bill works, the risk is outsourced to both contract manufacturers in terms of any products liability that might happen, and also to banks. They're the ones that would actually provide the money for the reward, and then they would then take the risk that the savings would actually materialize with the states. So with that, again, I want to thank Dr. Kumar and members of the committee for your consideration. Happy to answer any questions.
All right. Thank you. Do we have questions? Okay, so Speaker Marsh, you recognize.
Thank you, Mr. Chairman, and thank you for coming today. And my question is probably one that's right stupid, I guess, but who gets the money if there is a cure, all the savings, how is that dispersed?
You recognize.
Thank you, Mr. Chair. Whoever wants to come forward and claim the reward would be the owner of the intellectual property and the patent, whoever developed that. That's usually a combination with research universities or private companies that would develop it. That's the way it is now for anything that's developed. So that doesn't really change. It's if they want to come forward and claim the reward, and they get it up front. So they get a check from the bank. That's part of the mechanics. And that's actually more of an incentive than having to sell it over 7 or 8 years of the remainder of the patent. So that's who would receive the reward if they wanted.
Any further questions while we are out of session? Seeing none, thank you for traveling to our state, and this isn't your first time here, but fascinating concept. Appreciate your work on this, and looking forward to continue to work with you. Thank you.
Thank you, Mr. Chairman.
Right.
Thank you, members of the committee.
All right. Without objection, we are back in session. Chairman Kumar, you recognize.
Thank you, Mr. Chairman. I think this should inspire us all to go look for a cure. I would be happy to answer any other questions.
Any questions for the sponsor? Okay, seeing none, we are voting on House Bill 829. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chair and committee.
All right, thank you. We are going to go out of order without objection back to item number 4, House Bill 565. Representative Dixie, you're recognized.
Thank you, Mr. Chairman.
You have a motion and Second.
All right, thank you. So this bill is going to allow dentists the ability to give vaccinations. Dentists can already give shots in our mouth. So we want to try to get as many vaccinations as we can and arms as we can. So this bill, during the subcommittee discussions, I agreed to rewrite the bill to remove some of the blood bank language. And as a result, this only applies to dentists and replaces the remaining language under the Dental Practice Act. At the request of the Department of Health, the appropriate training will be based upon the CDC, and prevention guidelines. Dentists currently have authority to administer COVID-19 vaccines in 28 states. By putting this authority into statute, dentists will no longer depend on a federal action or executive order and could begin planning and implementation of continuing education plan, including ordering, storage, types of vaccinations, administration, and possible side effects, along with compliance with all regulatory and reporting requirements. So that's my explanation.
All right, thank you. And there were two amendments. I think there was one that came out of the subcommittee, but then you filed an amendment 6980. Is that correct?
Yes, and that amendment makes the bill.
Okay. You have a motion, second on that amendment. Okay. Do we have any questions on that amendment? Okay. Okay. Seeing none, we're going to vote on amendment 6980. All those in favor say aye. Opposed? Ayes have it. Okay. We're back on the bill as amended. Any further comments?
No.
Okay. Chairman Williams, you recognize?
Thank you. So where did this bill originate? I guess is a question. It seems to me like we have plenty of people or plenty of practitioners in our local health departments that are distributing vaccines. In some instances, there plenty of opportunity to do that. I guess what is the premise or who's driving the bus?
Well,
you're recognized.
I don't know, Dr. Bob, do you want to take? Okay, well, I'll answer a question. I have really good friends that are dentists. And one of my dentists, she's running the vaccine program for Meharry Medical College right now. And she said, we can do a lot of things, but we can't give shots. And she was like, we could help put a little bit more, be a little bit more expedient in getting the vaccinations to people who want them. And so that's how this bill came about.
Chairman Williams.
Is it limited to just COVID-19 vaccinations
Yes.
or any vaccination?
Just COVID-19.
Thank you.
Chairman Ramsey, you recognize?
Yes, and we've actually had bills of this nature for several years. The Tennessee Dental Association had gotten interested when the vaccines came out for human papillomavirus. Of course, being involved, and that's where some of the symptoms show up first is in the oral area. So we had been interested in pursuing this ability to give vaccines for several years. The COVID virus has kind of lit the fire again, and so we actually had a bill last year to do the COVID, and this is just the continuation of that. But the effort and the focus is that at some point we'll be able to give vaccines. Multiple vaccines, not just the COVID.
Yeah, thank you.
All right. Any further questions while we're on the bill? Okay, seeing none, we're going to vote on House Bill 565 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
That brings us to item number 8, House Bill 974. Chairman Williams, you recognize?
Oh, which one was this? Thank you, Chairman and members. House Bill 974 was a bill that dealt with opioid lawsuit settlements. My understanding prior to my attendance here that the committee was able to move out a bill that parties had agreed to. So I would move to take this bill off notice.
All right, without objection, House Bill 974 is off notice. That brings us to item number 9, House Bill 980. Chairman Williams, you're recognized.
Thank you, Chairman and members. House Bill 980 is a derivative of some challenges that are going on in my district back home.
You have a motion second.
This bill would allow for the removal of the CON for those psychiatric or mental health treatment and substance abuse facilities in rural Tennessee with the idea that we could facilitate the growth of these services in our community. Currently, if you present in at Cookeville Regional Medical Center and in the ER, it sometimes can take 4 to 6 days. If you're if you're in a mental health crisis, if you're required to stay in a bed in the hallway for 4 to 6 days waiting on a place to get moccasin bins, very difficult. Mental health services in rural Tennessee is a growing need, and I believe that this bill would allow us to facilitate that. I will say that there is a bill prior that's left this committee already which eliminates certificate of need statewide for these services. And so the idea with this bill is if there were something to happen to that bill, because it's more comprehensive, that this could be a backup plan to that. And so I'd ask the members for their support today. I also do have, legal has asked me to adopt an effective date amendment. I think we've timely filed with the committee.
Well, hold on. We have 2 amendments. So we have not adopted the first amendment, which was 5886. Is that? Okay, and that's the one that makes the bill. And then the second amendment would be the one for your effective date. Is that correct?
Yes, sir.
Okay, so without objection, let's vote on 5886. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, now we are on the bill as amended, or we're on the second amendment, 7452. Okay, you have a motion second, and that makes the effective date when?
October 1st, 2021 at 12:01 a.m.
Well, we're getting specific
Yeah,
here.
very-
Okay. All right.
Chairman asked.
All right. Any questions on
Move
that
passage.
amendment? Okay, seeing none, we're voting on amendment 7452. All those in favor say aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. Any further questions on the bill?
Thank you, Chairman, members. Those amendments make the bill. Happy to answer any questions the members might have.
All right, any further questions? Seeing none. Okay, we are going to vote on House Bill 980. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways, and Means. Okay, I am going to, hold on a second, go out of order here and take a chairman's privilege before we get into some of the what may be more lengthy discussions and go to item number 16, House Bill 582. I'm going to pass the gavel.
We have a motion and a second on the bill. Chairman Terry,
Right,
you're
thank you. And
recognized.
there's an amendment on this,
Okay, we have an
5536.
5536.
Right.
Okay, do I have a motion second on the amendment?
Motion.
Second? All right, you've got a motion and second on amendment.
All right, thank you.
Chairman
As
Terry.
many members know, several years ago, we passed the Teeing Together legislation, and by the end of this year, we will be getting a report from the Department of Health. And so what this amendment will do is it will, as part of their report on how the opioid legislation, the Teeing Together legislation has worked, it will be adding some information to that on how the COVID pandemic has impacted the Teeing Together legislation. In particular, what the COVID pandemic has done to lawfully prescribed usage of opioids in the state, unlawful diversion of opioids in that state, including have symptoms related to COVID or delayed care related to the pandemic, increase the amount of opioids being used or prescribed, and has that led to any decreased diversion? The ability for the department to collect the data to determine the impact and effects of the restrictions, limitations established in the section, and whether the impacts or effects from COVID have impacted the what we were trying to get out of the sunset on the Teeing Together. Teeing Together is set to sunset on July 1st, 2023, and we want to know whether or not the goal of decreasing the MMEs, the decreased diversion and decreased overdoses has been impacted, the trajectory of that teeing together by the COVID pandemic. So with that, I'll move passage. Ready to answer any questions.
Any questions of sponsor? Chairman Kumar?
Thank you, Mr. Chairman. Well, no, thank you for bringing this, because really we do need to follow up and keep track of the effects of TN Together, which was a major piece of legislation, and I know you were involved in it. I thank you again. Thank you, Mr. Chairman.
Chairman Carey?
Thank you for the comments.
Any other questions? Seeing none, any objection to question on the amendment? All right, we'll be voting on Amendment 5536. All those in favor say aye. All those opposed? Ayes have it. So now on the bill 582 as amended, Chairman Terry.
Appreciate your support.
Any questions? Seeing none, all right, question on the bill. We'll be voting on House Bill 582 as amended. All those in favor say aye.
Aye.
All those opposed? Ayes have it. The bill will be moving on to calendar and rules.
Thank you, Chairman and committee.
Oh.
Thank you for committee for that bit of indulgence. That brings us to item number 10, House Bill 920. Chairman Ramsey, you're recognized. You have a motion, a second.
Thank you, Mr. Chairman, ladies and gentlemen. This is a hot, sticky issue that affects us all. And what this bill does is adds cerumen management to the authorized scope of practice to be performed by licensed hearing instrument specialists under the Council of Hearing Instrument Specialists. We have an amendment 6203, which makes the bill and was brought to us by the Tennessee Medical Association.
Okay, we have amendment number 6203, is that correct?
Yes, sir.
Okay, so we have a motion, a second on that amendment.
And essentially, the amendment makes the bill, and it has requirements in it for safety's sake, for following regulations, requires the licensed hearing instrument specialist to follow regulations established by the council regarding cerumen management, carry appropriate professional liability, and maintain universal infection controls, as well as criteria that address the training that's necessary, which will be conducted by a medical doctor, otolaryngologist, and or one or the other. So with that, pending any questions, I renew the motion on the amendment.
Okay, any questions on the amendment? Okay, seeing none, we're voting on amendment 6203. All those in favor say aye. Opposed? Okay, ayes have it. We are back on the bill as amended. Any questions for the sponsor of the bill? Okay, seeing none, we're voting on House Bill 920 as amended. All those in favor say aye.
Aye.
Opposed? Okay, ayes have it. Bill goes on to calendar and rules. All righty. Chairman, if you would just bear with me. It's we have another member that's not on this committee that has a bill here to be heard, and if without objection, I'm going to pull that up and bring him up here. That would have been item number 1, House Bill 1421. Representative Grills, you are recognized. And to remind the committee, let's see here. We have adopted amendment Okay, so it's traveling with Amendment 5551. We've adopted Amendment 7248. So Representative Grills, you recognize?
Thank you, Mr. Chairman.
Much, sir.
And I was talking to some folks out there in the lobby, and I said, I feel like Ray Stevens' song, "It's Me Again, Margaret," back before this committee. But we've had some conversations over the past couple of weeks. So I'm back here. I believe that Chairman Ramsey, I think he had an amendment that he was going to file. That's the way I understood things as of yesterday.
Okay, before we get to that, I'm going to recognize Chairman Whitson.
Thank you, Mr. Chairman. And Representative Grills, you have done yeoman work on this. I just want to tell you. You know, we have a term in the Army called you got put in a do loop. We keep talking about this and moving it and adding amendments. We're going to have to include COVID-19, 20, 21, 23 as longer this takes. But again, I appreciate the work on this and I appreciate your intent. I don't think any of us wants to mandate a vaccine, especially one created under emergency use. But with that, Mr. Chairman, I'm going to make a motion that we move this to summer study.
Okay, that's a proper motion, proper second. Any objection? Is that a question or objection?
Just a parliamentary question.
Yes.
So sending this to summer study, many of you may know 15 bills is a limit that the House puts on. I guess the question is if we send this to summer study, he'd have to file another bill next year. If we send it to the next calendar, I don't think he's on the third roll. He could at least not have to refile another bill next year. I guess, can somebody confirm, since I've been wrong, I think it's 5 out of 5 times so far today.
All right, just 1 second, let me confirm with Lick. Okay, we do have a proper motion. The question, before we vote on that, I would ask the sponsor, would you be amenable to taking this bill off notice so that you would have a bill available for next session?
Thank you, Mr. Chairman. I worked pretty hard on this and tried to work with the committee as best as possible. And I understand that the posture that we're in now is there's some hesitancy here. And I don't want to see the bill die, but, you know, we've had lots of conversation and we put ourselves on the line over and over again. And like Chairman Whitson said, we've kind of like the cat chasing his tail. We're running around in circles. We're not going anywhere. But if that would be the pleasure of the committee, I would be willing to work with the committee to do that. Because, you know, we have a committee process here in the House and I want to work with each and every one of you the best way possible. So if that would be the pleasure of the committee, I will subject to their recommendation.
All right, I will ask the sponsor of the motion to withdraw the motion.
Thank you, Mr. Chairman. Sponsor, do I understand that you're going to take it off notice?
If that's the best, if that is the best route, and that's what the committee recommends, that's what I would do, Mr. Chairman Whitson.
Question, can the committee recommend it be taken off notice?
Chairman Terry, I would like to take, if he will rescind his motion, I would like to take this off notice.
Okay, good. That's what I want to be clear.
Okay, thank you.
Okay, the motion is withdrawn. At the request of the sponsor, House Bill 1421 has been taken off notice. Thank you.
Chairman Terry, once again, thank you guys. This has been a learning experience over the past few weeks, and I've learned a whole lot. Thank you, guys.
Thank you. All righty. That brings us to, I believe, what are we, item number 11? Item number 11, Chairman Ramsey, you are recognized.
And
House Bill 1284.
And
You have a motion and a second.
Thank you, Mr. Chairman. And here again, we have an amendment that's been offered to us by the Department of Health. It's 7326. And
Okay. Let me, before we get to that, so we have an amendment from the subcommittee. Does this amendment that you're wanting to run rewrite the bill as well?
It does. It
Okay,
deletes
all right.
all language.
All right, so we are on amendment 7326.
Yes, sir.
Okay. You have a motion and a second.
what we have is the amendment allows and speaks more clearly to the use in dentistry of in examinations. And the intent of it is the original bill was to allow all dental proficiency examinations to use non-live patients, specifically through the use of 3D computer models. And of course, this is a bill like many of the others, like that wonderful bill about mixed drinks to go today, that extends things that we learned during the pandemic. So that's what this does is open the opportunity for dental examinations to be done on live patients or mannequins of specific types, with including 3D computer models.
All right. Any questions for the sponsor on the amendment? Okay, seeing none, we're going to vote on amendment 7326. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, that brings us, we are on the bill as amended. Any questions for the sponsor as amended? All right, question's been called for. Without objection, we are voting on House Bill 1284 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, ladies and gentlemen.
All right, thank you. That brings us to item number 12. House Bill 1596. Chairman Ramsey, you're recognized. You have a motion, a second, and I believe there is an amendment that rewrites the bill. 6688, is that correct?
I think, yeah, that is correct, sir. Yes.
Okay. All right. You're recognized.
And
you have a motion, second on the amendment.
And this amendment, what it does is qualify specific hours that are spent. What this bill originally intends to do is require the Department of Health to give a one-time stipend of $1,500 within 1 month of the effective date to healthcare professionals who provided healthcare service during the state emergency. And the amendment trims that down to a certain number of hours that were worked in first responder, I guess, occupation. So they list the 8 categories here, and of course this is a significantly expensive bill. It came to me from the Senate, and certainly is a bill of estimable, I guess, sense of accomplishment for the folks that were involved. But with that explanation and pending any questions, it's just a matter of funding it.
All right. Do we have any questions on the amendment? Okay, seeing none, we're going to vote on amendment 6688. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. Any further questions for the sponsor of the bill? Okay, seeing none, we're going to vote on House Bill 1596 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you very much.
Right. We have disposed of item 13, so that brings us to item number 14. House Bill 1045. Chairman Kumar, you are recognized. You have a motion and a second. There are, you want to go ahead and speak there? Like, there are 3 amendments here, but if you want to go ahead and, you're recognized.
Thank you, Mr. Chairman. Yes, there are 3 amendments, and they all have been brought in piecemeal. They all do need to be added. First one is 5274.
Okay, with amendment number 5274. You have a motion, second. You're recognized.
This is the amendment that mainly makes the bill, and this has to do with public safety and protection when a prescriber is indicted, that their license will be immediately restricted in regards to being able to prescribe controlled substances, specifically Schedule II substances and opioids. In addition, if a physician's assistant or advanced practice nurse is working with an understanding of agreement with a supervising physician, but they are practicing without such an agreement, then again, their license will be suspended until they get the agreement in order. And thirdly, it asks the hospital and various medical facility CEOs to report to the relevant health-related boards any offenses on part of practicing physicians and prescribers, including incompetence, negligence, moral failure, substance abuse, or any legal action against them.
All right. Any questions for the amendment, on the amendment? Okay, seeing none, we are voting on Amendment 5274. All those in favor say aye.
Aye.
Opposed? Okay, ayes have it. Okay, the next amendment is 6677.
Yes.
A motion is second on that amendment.
Thank you, Mr. Chairman. This one, instead of saying that the person who has been indicted of wrongdoing based on prescription or sexual conduct is not allowed to prescribe not all controlled substances, but only Schedule II substances, the high-level narcotics and opioids.
All right, any questions on that amendment? Okay, seeing none, we're voting on Amendment 6677. All those in favor say aye. Okay, opposed? Ayes have it. We have added that to the bill. Now we have Amendment 7330. You have a motion second.
Thank you for your patience. This amendment deletes the words chair of the board shall immediately, to make it chair shall automatically and immediately suspend the prescription abilities of the person who has been indicted of misconduct.
Any questions on that amendment? Okay, seeing none, we're going to vote on Amendment 7330. All those in favor say aye. Opposed? Ayes have it. Okay, and we are back on the bill as amended. If this bill passes, I would ask that legal roll all these amendments into one amendment for the purposes of the floor. So without objection, we will roll those into one amendment. So we are back on the bill as amended.
It's basically, again, a public safety and protection measure in which it was concerning to see people who have been indicted of misuse of opioids and controlled substances are able to continue to practice and still prescribe them. Once they have been indicted, that legal action has been initiated, this will go into effect to restrict their license, not restrict or not suspend their license to practice. And similarly, people who are expected legally to have a collaborative arrangement that they're working under a physician's supervision, and they do not have that in place, but are working, again, their license will be restricted or suspended until they are in order and have a proper agreement in place. Thank you.
Thank you. Representative Clemens, you recognize.
Thank you, Mr. Chairman. And I just want to get clarification from the sponsor on one of the amendments we put on with regards to simply limiting their ability to prescribe Schedule II as opposed to any controlled substance. Why would we not want to limit their ability to prescribe any controlled substance if they've committed a crime?
You recognize.
Thank you. I think you're right. Initially, that was the plan. Apparently, there was difficulties in the Senate, and they adjusted that. And I think the idea was to allow, we are treading into territory, a person has been indicted but have not been convicted. And how far can we go in to restrict their ability to practice? And lesser substances, Schedule 3, 4, and 5, were considered relatively safe. and mainly restrict their ability, because most of these offenses, almost all of these offenses, occur on Schedule II substances, which are, again, hardcore narcotics and opioids. And the idea was to restrict that ability.
Representative Clemens?
Yeah, well, thank you. I appreciate that explanation. And I don't want to defeat what I understand your intent to be here with that compromise with the Senate. Because, if someone has shown that propensity, even though they're only indicted as opposed to convicted, it seems like there's a issue that we're dealing with here. Obviously, we're limiting their ability with Schedule II. So I just wondered if we're contradicting ourselves or not accomplishing our ultimate objective by amending that. But I understand why you compromised. Thank you.
Chairman Kumar.
The expectation, Representative Clemens, is also that once a person has been indicted, they know they are under the microscope, and chances of abuse on the other substances are not there. I think they know they should get the message. Thank you, Mr. Chairman.
All right. Chairman Williams, you're recognized.
Yeah, had another conversation going on there. My apologies. Dr. Kumar, I appreciate the tenet here. So I just want to make sure that I understand this because I'm not in the subcommittee and I haven't been able to follow it. But what you're saying here is that someone has not been convicted of a crime. They have been charged or indicted with a crime. And we're going to, as it relates to how they provide their family, we're going to limit their ability to provide for their family until such time that case is adjudicated.
Chairman Kumar.
Thank you, Mr. Chairman. It's a matter of balancing the protection of the public and, yes, putting restrictions on somebody who has not been formally convicted. In this case, because their license is not suspended, they will continue to practice. They would not be able to prescribe the Schedule II and hard narcotics. Everything else, antibiotics or milder pain medications and so on, they will continue to do so.
Chairman Williams.
How comfortable as a clinician are you, a physician are you, that someone, subordinate or someone in your office could charge you or testify against you as if some criminal indictment or one of your persons in your office write prescriptions without you knowing? I guess my concern would be is this charge, is this violating the idea of, guilty until proven innocent? I guess that's my biggest concern really with the current language.
Chairman Kumar.
Thank you. I appreciate concern in the sense that the due process has not occurred. On the other hand, a grand jury has issued an indictment, so there is probable cause. We cannot really suspend that person's license and take away their ability to make a living, but at the same time, we have an obligation to protect the public. And this bill or this law would work towards allowing a person to practice, but restrict the most potentially harmful thing they could do, that would be to be prescribing hard narcotics and so on. And the other thing, on a personal note, what we have learned that since this opioid crisis and we passed TN Together bill and restricted the use of opioids, it's amazing how well you can practice without using opioids much. It's really been remarkable, where a patient coming in to have surgery, we used to give them routinely 30 pills to go. Now we don't give them any or give them 2 or 3 days at most. Other alternatives are available, and well, they have been available. We just learned to use them better. So I think these people are able to practice.
All right. Any further questions on the bill as amended? Okay, seeing none, we are going to vote on House Bill 1045 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us to item number 15, House Bill 880. That is my bill. I'm going to pass the gavel to Chairman Ramsey for this bill. Thank you. And I have an amendment number 7340 that makes the bill.
Motion.
Right. All right, thank you. This amendment for House Bill 880 makes it a decriminalization bill for patients who possess non-smokable, non-vapable, non-edible cannabis-based medicines. And what it does is it simply removes the simple possession charge for patients who comply with the provisions of the bill. This amendment I have worked on. I have worked with the speaker on that, and he said that I could say that he supports the amendment. What it does is it sets up some bookend studies that directs the Department of Health to conduct a baseline study of medical cannabis licensure in contiguous states by the end of this year, and a follow-up study it will include positive, negative impacts of medical cannabis from Section 2 of this bill, and that would be that study would be conducted by December 2024. This bill establishes that a patient must have a bona fide patient-physician relationship must exist, and they must have an attestation letter of diagnosis, and that the letter is valid for 1 year, and it provides a list of qualifying diseases, 11 diseases, and it limits to the forms of medical cannabis can be in a ointment, lotion, transdermal patch, suppository, a spray, a nasal buccal sublingual spray, an aerosol, tincture, oil, or capsule. It limits the amount that someone may possess to 2,800 milligrams, and that amount equilibrates also if you have a half an ounce of marijuana, which is a simple possession charge and that has 20% THC. That is the amount that it correlates with that. So that's why that's in there. This bill does not allow for any smoking or vaping of cannabis. This bill says that there's no impact on the drug-free workplace program, so they can still be subject to that. And DUI laws can still be enforced. This bill does not allow Tennessee to grow. Again, does not allow you to smoke, vape, or eat any cannabis products, and it does not set up any licensure for any dispensaries or facilities. And with that, I'll be happy to take any questions.
And I would like to say, this is a small departure from typical policy in the committee, that I would be handed the gavel. However, this is a very sensitive issue. It's a kind of a mirror of the bill that I had in here for Doug Gunnell's son, which he passed away when we were presenting it in full committee. So the bill has a sense of, for some of our members, a sense of repulsion. So that's the reason I got the gavel. This is a bill that I totally support. And so I'm going to shut my mouth and let anybody that wants to comment or ask questions on the amendment. I think you said 3740.
Yes.
We did have we had one. Yeah, I gave it. So do we have any questions or comments? Yes, sir. Chairman Williams.
Thank you. For the chairman, been a long time since you chaired Health Committee. I was a young freshman member when you were doing that.
I thought it felt somewhat familiar.
I would offer verbal amendments since you said we used to do them, but I won't do that. I will say this subject matter is really important to me. Many people probably don't remember this because you weren't here, but I was one of the first Republican members to ever carry a medical marijuana bill in the state. It's something that I believe is something we should all consider, and particularly if you're like me and my wife, when we walked a long road with someone with terminal illness, it's a dramatic, different view. I will say, Chairman Terry, one of the concerns that I have is with these types of bills are what the acceptable diagnoses would be. There are some that I feel like personally are acceptable and some that are not. And it usually determines my support or thoughts about it. I wondered if you could share with me and the body what the diagnoses might be.
Chairman Terry.
Thank you. Appreciate the question. And you and I have talked about this before, the diagnoses that we have in here, and this was something that working with the Senate on, obviously, there are others that could be out there, but this is working with the Senate and with the Speaker. Alzheimer's, amyotrophic lateral sclerosis, ALS, cancer, including, and that's limited to some of those symptoms. Inflammatory bowel disease, including Crohn's disease and ulcerative colitis, epilepsy or seizures, glaucoma, multiple sclerosis, Parkinson's disease, post-traumatic stress disorder, HIV or AIDS, and sickle cell disease.
Chairman Williams.
Thank you, Chairman. Chairman Terry and I have discussed this at great length. The two on that list that give me great concern are IBS, as it is a debilitating disease, but not one that is what I would interpret to be terminal. And then the other, as you and I have discussed probably multiple times, is the diagnosis of PTSD. I want to be able to support our veterans as it relates to this subject matter, but as we know from California, that it seemed like the number of cases of glaucoma in California seemed to be on the rise when we made medical marijuana legal there. My concern about PTSD is that we would have the same thing in Tennessee, but I would like to see us narrow it to those veterans who have served in active duty as it relates to PTSD instead of an open-ended PTSD diagnosis. And so as much as I appreciate the chairman and the members, it's because of those two reasons that I won't be supporting this today. Thank you.
Chairman Terry.
Thank you. And I appreciate your comments on that. I just would like to point out that for somebody to get a diagnosis of PTSD, again, they'd have to go through a bona fide patient relationship, during the course of which the practitioner has completed an assessment of the patient's medical history and current medical disease or condition, including an appropriate examination and confirmation of the patient having that qualifying medical disease or condition. The DSM-5 requires, I believe, 10 steps to get that qualified medical condition, and the attestation letter from that from the practitioner has to attest that the patient has received conventional methods of treatment for the patient's qualifying medical disease or condition, and those methods have insufficiently addressed the patient's disease. And so it's not just going to be somebody that's just getting a rubber stamp on this. There's a process by which we have that. To the point on the inflammatory bowel disease, again, there's a lot of research out there that's on that, but I would point out that some of the medications that some of these patients that get for inflammatory bowel disease, high dose steroids, or some of these biologics that cost anywhere from $100,000 to $100,000 to $30,000 to $100,000, and so that's part of why that's in there. Thank you.
Chairman Kumar, pardon me, Doc, you're recognize you. I think you wanted to speak. Go ahead.
Well, thank you. Chairman Terry, once again, thank you for bringing this bill. You worked for many years with it, and I have worked many years against it. The problem is we are creating a new definition of medical marijuana. Medical marijuana to me is, one, it will help the patient and they should have it. But that should be based on science, not on internet and number of conditions that we can pick out. Two, one very important part of medical is that it's medical, there's a doctor involved. Patient is under monitoring. Here, who's going to tell the patient when the time comes, hey, watch it, you're using so much of it, you should not be driving. There is no monitoring built in here. It's basically, you're gonna get a letter, now you can possess it. Also, we are going to create a letter writing industry. Letters are gonna come from the same doctors who overprescribed opioids. So my problem is that we are creating a new definition of marijuana, which is not medical, it's not under monitoring of a physician, there's no mention of it. There is no mention of even age limit in this. And we know on the teenage developing brain, marijuana is harmful. It will slow things down by way of IQ. And the most major problem, as Chairman Williams mentioned, is the number of conditions you pick out. There has to be some degree of a scientific evidence for it. I took the liberty of sending out a table from the 2017, the most comprehensive study about indications for marijuana from the National Academy of Sciences. It's very, very complete. And in that, again, there are 5 conditions for which it is helpful. And the rest of the conditions, there's a maybe column, and there's a no good column, and there's a harmful column. So it has its own complications and harms. Alzheimer's is under the no good column. Similarly, a lot of the other, for inflammatory bowel disease, no, scientifically there is no evidence. I practiced a long time. I treat inflammatory bowel disease, no, there was no scientific benefit from it. Parkinson's, also things are iffy. In some people it would help, in others it would not. And PTSD, depending on the psychological conditions connected with it, it can really make matters worse. It can be really dangerous in that situation. So given the dangerous use of these substances in unproven conditions, I really feel concerned about the possibility of this bill passing.
The only one is this one.
Once again, I think the basics remain. If it helps a patient, it's our duty that they have it, but that should be based on a proper indication for which there is medical evidence. Thank you. Thank you, Mr. Chairman.
And Chairman Jernigan, you're recognized.
Oh, can I respond?
Pardon?
Can I respond?
Oh, I'm sorry. Chairman Terry, you're recognized.
Thank you. I appreciate those comments, and you know, I've had conversations on this. I just like to point out, you know, speaking from age limit, you know, there are children that have seizures, and it's I've spoken about this on several occasions about someone that I've come to know and know their family, and by age 7 she began having seizures. By age 9 she'd been on 30 different FDA approved regimens. And at that point in time, her family was given the option by their doctors: you can either have an experimental brain surgery or try another medication that was FDA approved that could have killed her liver or killed her bone marrow, or you can move to Colorado and enroll in a program and see about getting cannabis relief there. And so they did that. She's been seizure free since then. She takes oils twice a day. She has a nasal spray as well. And this bill would help those patients like her, understanding that when people have multiple seizures, there's harm in that. And that impacts their development, it's a stress on their body every day. Many medications that we have, we use off-label all the time. From a cancer perspective, I will tell you that I have patients that come in about to have surgery, and they will tell me that they are going to the street. I mean, it's a $1.5 billion illicit market here in the state of Tennessee, and we have cancer patients going to the street to try to decrease the amount of opioids that they're taking. I've had to take care of patients in surgery that have had bowel obstructions because of the amount of opioids that they're taking. So again, we use things off-label, and we have an AG's opinion that says that the DEA, which is part of the Department of Justice, has also not made it a policy to suspend or revoke the authority of physicians or pharmacists to prescribe and dispense controlled substances under federal law as a result of a medical professional's participation in a state medical cannabis program. And this is just an attestation letter. This is not participating in a major program where they're prescribing. So with that, I appreciate the comments.
Chairman Kumar.
Thank you. Thank you, Dr. Terry. I respect your experiences, but I would say that epilepsy in a child is treated with CBD, which is the non-psychoactive substance in marijuana. it's not treated with THC. And if it is treated with THC in the teenage developing brain years, American Academy of Pediatrics is quite upset about it, because that's one thing that has really been proven, the effect on IQ of a developing brain with THC. So I think we have to differentiate that. CBD, which is the non-psychoactive part of marijuana, has been approved for even by the FDA, and the synthetics are available to treat that. Once again, it's not medical if it's not based on medical science and proven indications. There are 4 or 5 proven indications, and it's not medical if it's not being monitored by a physician. Physician just writing a letter is not really participating in medical marijuana. And I think that the monitoring is very important if these people are going to be on medical marijuana for a long period of time. Thank you, Mr. Chairman.
Chairman Jernigan.
Thank you. I've spoken on this issue. I've co-sponsored bills. I've talked about this over and over again on the diagnosis. I'm not a doctor, but I have been on the diagnosis side of this. Frankly, I wish quadriplegia was involved in that, but I'll take one step at a time. But these diagnoses, and I'll have to disagree with Dr. Kumar, and that when you pick a diagnosis out, and it's not, and I'll just pick one out, Parkinson's. It's not going to, just because you have Parkinson's doesn't mean, you're going to have this. It should be a case-by-case basis, and the physician will recognize that. I do not think it can equate to California, where you can smoke it and edibles and everything else to abuse it. That's not what this bill does. It's not what it's intended to do. With 38 states have said, okay, we're wide open on this. We are very, very narrow on how we're doing this, and we're very narrow on the diagnosis that can be opened up. I think the chairman is just asking for a little bit of empathy for some of these folks to relieve their pain and suffering, and ask for some legislative relief on this. I disagree. I mean, I understand where law enforcement comes in, because it's a Schedule I, and this does not open up the doors to anything but helping those that need help. And I implore you, and I can't tell you, when you're at least in my case, and I've testified in subcommittee of what it, the heart spasms that I have at night for being in a chair for 14 hours, that I can't try something like this, and I hope in the future I can. Just to have a little bit, I can't do CBDs because it loosens everything up, right? Including my bowels. I can't do that. That's crazy. So I need something, right? And this could give an opportunity to do that. I don't think it opens up any floodgates. I disagree with Dr. Kumar that, medical science, it's what a doctor does. At the end of the day, a doctor is prescribing this and saying, yes, in your particular case, it's going to help you. And that's what we want to do. Please give some relief to some of these folks. I'll be supporting your bill. Thank you for being vigilant on this, for constantly bringing it back. I get constant contact with emails and communications begging this to happen. And you've been a champion on this bill. And I thank you, and I'll be supporting it today.
Chairman Kumar.
Thank you, Mr. Chairman. Chairman Jernigan, you disagree with me, but I actually agree with most of your statement except for the last one. And that is, you're saying a doctor is prescribing it. He's not. Doctor is not a part of the picture except giving a letter. Doctor is not prescribing it. He's not able to. That's not legal. They would run into problems with the DEA license. Doctors have 2 licenses, one to practice in Tennessee, the other to prescribe controlled substances that comes from the federal government. They will run into problems with that. So a doctor is not a part of this. That is why I don't think it is medical. As far as treating the situation, you and I have talked about your condition. Everybody loves you, and so do I. And we want you to be well. But remember, your own doctor said that the stuff that you bought, these over the counter or stuff that we are buying from other states, there is very little regulation. There is very little knowledge about what's in that bottle. Their dosages differ from lot to lot. That is why it's not medical. It's not supervised by the FDA to say that there is so many milligrams of the substance in it. And I remember your own doctor's remarks were, you said everything loosened up and you were having difficulty with it. And your doctor said, well, gee, Darren, you might have gotten castor oil. Those were his words. There is no control on these substances and the dosages in it. So, but really, again, there should be scientific evidence. We should not be picking out diagnoses out of the hat and conditions out of the hat. It should be under medical care and it should be under medical monitoring. Now, that is actually possible because synthetics approved by the FDA are on the market. Any physician with a license can prescribe it, and the studies have shown them to be equally effective. So in that sense, medical marijuana in the right context is available. Again, these marijuana synthetics are available, FDA approved, doctor can prescribe it, doctor can monitor it. And I think that's how it should be.
Chairman Jernigan.
Thank you, Mr. Chairman.
Go ahead.
Thank you. I will concede on the prescription part. I was wrong on that, but the doctor is involved. But I will also say this, Dr. Kumar and my own doctor, but until you both have my condition, I really don't consider your scientific evidence when I live it every day. Thank you.
Further comments or questions? We're going to be voting on putting the amendment on the bill. All those in favor say aye. Aye. Any opposition? We're back on the bill as amended. Do we have questions or comments on the bill? Chairman, yeah.
That'd be Vaughn.
There you go. I was, for some reason, I couldn't get emoji out of my mind. Chairman emoji.
I wear that title with pride. Thank you, Chairman. And really, I'm not wanting to engage anybody in debate, but I just want to share my feelings on this. And I say thank you, Dr. Terry. If you've had a friend that's died of cancer that has been trying to stay conscious, to spend their last days with their family so that they won't be stricken by being knocked out by opioids, that want just a chance to be with their family, and today's science and practices would not allow that, then you can understand why people would support this bill. And that's why I'm supporting it. And again, I don't require a debate. I don't require a response. That's just where I am on this bill. Thank you.
For the comments or questions on the bill as amended. If not, we'll be voting to send this bill to criminal for double referral. All those in favor say aye. Aye. Any opposition? So approved. I turn the gavel back over to the master of ceremonies.
All right. Thank you, Chairman and Committee. That brings us to our special calendar. So that is item 1088. So bear with me just for 1 second here. Okay. So the sponsor, is it your intention for us to send this to the clerk's desk? Yes. Okay. So without objection, House Bill 1088 to the clerk's desk. All right. So we have finished our last calendar. I will tell you, I truly appreciate everybody on this committee. This has been, of the years that we've been up here, this has been one of the most thought-provoking debates that we have had, several debates that we've had on multiple different issues. I thank you guys for that. Thank you for your hard work. I think we've done some significant work this year, and appreciate you guys working with me. And is there any further business? Speaker Marsh, you recognize.
Thank you, Mr. Chairman. And this is my first year being on health, and I can't say that I really like a lot of the topics, but I think you did an excellent job running a committee, and I enjoyed being on it and learning a lot. Thank you.
Thank you. All right, thank you. So adjourn to the call of the chair. All right. All right, without objection, we are adjourned to the call of the chair.